Scapulothoracic mobilization.
Okay, so we're going to do distraction of the scapula on this patient. So we're going to have the patient positioned so that they're facing the clinician, get them in a sideline position, get them close to the table, okay? Make sure the patient's secure. And basically what I'm doing is I'm going to take the scapula, I'm going to try to move the scapula and distract it away from the thorax, away from the rib cage. A good technique to do that when I get in position is I take his arm, put it over top of mine, get the patient to relax. I'm going to use the pisiform or lateral side, or rather ulnar side of my hand, and I'm going to palpate into the coracoid process. I use the pisiform as the coracoid process to push the scapula out. My other hand, my caudal hand, is down here finding the lower inferior border of the scapula, because this is going to come out as I push this in. So you can see, as I push him into position, I can get up under the scapula and I can literally lift and distract it. Okay? Get under the scapula and do distraction from that point. That's scapular distraction. Okay? Just lifting the scapula off of the thoracic spine. The next position we're going to do is a superior inferior glide. Same deal. Get into position, get close to the patient. Once again, if this patient was a female, I would put a pillow so there's a barrier between the clinician and the patient. But I get in close, distract. My hand is around the inferior border of the scapula, inferior angle, and I'm going to do a superior glide. I'm going to do an inferior glide. It all comes together. Superior glide, inferior glide. It's like I'm sandwiching both of my hands to there. From this position, I can also do a medial glide or a lateral glide. So this is a medial glide, lateral glide. I can also do upward rotation of scapula or downward rotation of scapula. All from that position. Upward rotation, downward rotation. I like to finish up with a scapular subscapularis massage, where I'm just rotating the scapula and rubbing subscapularis against the rib cage. Okay?